Winter in Colorado is filled with activity. Skating, skiing, and sledding are just a few. Along with the fun and laughter, these activities sometimes bring unexpected injuries.
It was a beautiful day that day. It was one of the first days that we had some really great powder. And I thought, wow, let's go out and go sledding.
A person got in my way, so I turned, but then it was headed for the direction of the fence, so I tried to turn, but then it was too late.
He hit the fence, and as I was coming down, and I kind of slowed down, and I went over to him to see what was happening, and he was just kind of laying there.
Ryan came into the emergency room in the late morning, I think it was, and he had been sledding, and without a helmet, if I remember right. He went through a chain link fence and hit a concrete wall.
My biggest concern when we reached the emergency room was for Ryan and his special needs, because Ryan has Asperger's syndrome. And if there's a lot of lights, there's a lot of sounds, those kind of things can really set him off.
Ryan was doing well. We knew from his CAT scan that he had a big laceration or a cut in his kidney from his injury. But he was stable at that point, and so the plan was to send him up to the ICU for further monitoring in hopes that we wouldn't have to operate on him.
The CAT scan said, hey, he's got a ruptured kidney. So then they took him up to ICU, and then he began to, his blood pressure, I guess, kind of went down a few hours later, so that's when they realized, hey, we need to, the doc says we're going to need to take out the kidney.
So we got him in the bed and saw his blood pressure, and then all of a sudden there were like 5 or 6 people in the room taking care of him, and within about 30 minutes, I think we had him down to the operating room.
Once Ryan got up to the PICU, the Pediatric Intensive Care Unit, that his blood pressure had fallen to dangerously low levels.
I was just in shock that 2 hours ago we were on the slopes sledding, and now my son's going to lose his left kidney.
I think the first words out of his mouth were, he said, "What happened? What's going on?" And, "Well, you're done with surgery." And he leans back and he goes, "Hallelujah."
But Ryan's brother, I remember, was pretty somber, not much of a reaction at all, seemed to be very anxious and worried about what was going on with his brother. Part of our role in the hospital is to focus on sibling support. So if there is a patient that's admitted that has a breathing tube in his mouth or is unable to communicate, that can be a very scary thing for any age sibling to see.
At Memorial Hospital for Children, we have pediatric specialists that are all specifically trained in pediatrics, so they are used to seeing a child rather than a person.
We try and do a lot of medical play around here, so the medical equipment isn't as scary. So filling up syringes with paint or making water guns out of IV tubing, it's all part of the fun of making this scary environment less scary and intimidating for kids.
There are just so many different types of therapies that we use, and I think that there's horses that come through the halls, there's dogs, and it's amazing to see the difference in the faces of the kids when they see all these different pets come through, and it just really sets it apart, I think, because we really try to focus the care towards the patient, because they're not small adults, they are a child, and you need to treat them like that. With each child that you have, they present different challenges with each patient that you have, and Ryan specifically has Asperger's syndrome, and one thing that he and his mom both told me when I first received him as a patient was that he likes to be warned if we're going to touch him or take a blood pressure or temperature. He just likes to be well informed.
It was a pleasure to just see the nurses and doctors interacting every day. They included us in on the rounds, which I've never experienced in a hospital setting before, and I felt really empowered. And I felt like they really respected our wishes and really respected our knowledge as parents.
Memorial Hospital for Children has a history that dates back almost 3 decades. And it started with where a nurse, Kathy Winder, and a physician, Dr. Robert Greensides, my former partner, decided that one room was going to be called the Pediatric Intensive Care Unit. And that grew from a 1-room intensive care unit to a 4-room intensive care unit to a 12-room intensive care unit to the 16-bed intensive care unit that we have today.
We have a pretty robust pediatric emergency room, and so it's a whole separate area staffed by separate physicians that come in. We have separate pediatric surgical services, so general services, which myself and my two other partners provide, and then there are pediatric subspecialty services in surgery. That's neurosurgery, that we also provide, as well as pediatric orthopedic surgery here at the hospital. And then we have general pediatric services and most of the subspecialties that are covered under that as well, including gastroenterology, hematology, oncology, cardiology. All of those are available here.
This allowed, these facilities allowed Memorial Hospital to attract a cadre of very excellent subspecialty physicians, given the ability to, given a hospital where they could take care of these very ill children. In the beauty of Colorado Springs, it was really easy to attract pediatric subspecialists.
We're the only children's hospital and the most comprehensive children's facility in all of Southern Colorado. For me, the reason that I came here is because this is a children's hospital within a hospital.
The best news is that for the residents of Southern Colorado, they can know that their child, their infant, is getting quality care in their hometown